Dr. Ken Ho here at Gordon Family Dental, coming to talk to you today about that unpleasant and slightly embarrassing condition that some of us may not realize we have, but everyone at some time does suffer from it. Bad breath, or halitosis. There are many reasons why even in healthy people they have bad breath, and that's because of the bacteria that's built up in your mouth, especially on the top of your tongue. So the three categories that could contribute to your bad breath I'd like to talk to you about today is firstly, poor oral hygiene. Food debris that's left in your mouth can contribute to bacterial growth. So that's the first thing. Gum or periodontal disease can also harbor bacteria under those inflamed gums. And thirdly, dentally, under your fillings, and if you don't clean under dentures and dental decays that's misdiagnosed, can also contribute to the bad breath. The second category of things that can cause bad breath are foods that we eat, or even if we don't eat. For example, garlic, onions, we know are odor-causing foods that when we digest them, gets into our blood system, and when we exhale through the lungs, that's what we can smell. If we don't eat, or we miss out on eating, or we're dieting, but the burning of fats can also release compounds called ketones, and this could contribute to the smell. Dehydration, missing meals can also be a contributor to your bad breath, because saliva and water helps to wash away the bacteria that's built up in your mouth. So all this also contributes to why we can get bad breath in the morning, because there's a decreased saliva flow, because we're not drinking when we're asleep, and this all reduces the ability to wash away the bacteria that's in our mouth. So the third category that can contribute to your bad breath are certain medical illnesses and conditions, such as diabetes, liver and kidney disease, chronic sinus infections, pneumonia, bronchitis. These are all contributors slowly to your bad breath. Now, a very important category for dentistry to be aware of is dry mouth. And this could be caused by certain medications that you're taking, or more severe treatments like radiotherapy and chemotherapy. So be aware that if you do have a dry mouth, see your dentist or doctor. And don't forget about tobacco and cigarettes. This causes the body to have a reduced ability to battle against the bacteria that's in your mouth. It also dries your mouth out. So, how do you prevent bad breath? In those three categories we spoke about, firstly, practice good oral hygiene. That means using an approved toothbrush and toothpaste with fluoride, and get in there and clean those food debris that's left behind. Get that plaque and the bacteria out of there. Remember to floss in between your teeth. And if you have any dentures, take them out, give them a good clean. If you have a bridge, you have to get underneath there and clean under all your bridges. And the most important is clean the tongue, the top of the tongue and the back of the tongue. There are products available now that you can get to scrape and clean the bacteria and the plaque that's left on your tongue. You'll find a huge difference if you do that. Secondly, be aware of the foods you eat and cigarette smoking, as we talked about, and drink and hydrate yourself regularly. Nothing works as well as just hydrating and reducing the bacteria by just washing away with nice clean H2O. And thirdly, visit the doctor if you do have those chronic medical conditions to see what else can be done. And visit your dentist regularly. They can also help you with reducing your cigarette smoking. And finally, a hint. If somebody offers you a breath mint, take it. They're trying to tell you something. If not, come and see us at Gordon Family Dental, and we'll do what we can to help you with your bad breath.